Hello, everybody. This is Professor Anthony Disson here to share with you some information about how food, nutrition, and dietary choices play a profound level of influence on things like lower back, pain, overall spinal health, and some common things that you will be seeing in your work, and how there can be a synergistic relationship between physical therapy and nutritional sciences and dietetics. Uh, I am going to assume I'm not sharing here too much information that some of you aren't already familiar with, but just understanding again that something like lower back pain, which so many people sort of just casually toss aside as one of those things, it is incredibly prevalent, and it especially becomes more prevalent as we age, of course, but it is becoming more than just a burden in terms of my daily wellness, although that is certainly important enough of a reason to address as it is, but it's becoming the second leading cause of disability within the United States. And what's incredible about it is that in so many cases, this is something that is almost purely related to lifestyle. Of course, with congenital reasons and other types of injuries that can cause obviously issues with lower back pain and spinal health, but more and more evidence is showing just how much our lifestyle and our dietary choices in particular play more of a role than most people truly give it credit for. In fact, it's becoming so prevalent that adolescents and even children, so preteen children, are complaining and being diagnosed with chronic lower back pain. How is this possible? I mean, really think about it with your understanding of the human body and what is going on with growth and development. How is this possible, and why now? What is happening now? Dietarily, and even beyond diet, because this is really physiologically, but understanding again how nutrition plays such a role, cholesterol does more than just impact our heart health. Think about how our circulatory system works. It isn't just heart, right? The heart is, of course, part of our circulatory system, but what branches out from the heart and from the chest? All of our veins, arteries, capillaries, all that circulatory tissue that literally moves from head to toe. Well, if something is causing occlusion in our arteries and our tissue close to the heart, where we're going to experience a heart attack, think about how, at least comparatively, large the diameter is, large that lumen is within the space of our veins and our arteries closest to the heart. Well, then think about how small that space gets as we move distally from the heart and how much more narrow those become. Those are being blocked with plaque too. Those are being blocked with cholesterol and foam cells and other things as well. Every part of our body requires blood flow. Can you think of a single tissue, a single organ, a single system of the body that would not be impaired with poor quality blood flow? And what is one of the most influential factors that can determine either the aqueous, easy flow of our blood or the viscous, thick, or even blocked flow of our blood? It is cholesterol. It is not only the cholesterol that builds up in plaques, but it is the cholesterol literally flowing through our blood constantly. As fats enter the bloodstream and those levels of fats increase, you can look and see this. The blood becomes viscous. It becomes cloudy. It becomes less watery. It causes difficulty with blood flow. So it's impacting everything. And our spine and all of the tissue that surrounds it is by no means immune to this. And especially when we think of how delicate and small those tissues are and those vessels are that are feeding the bone and feeding the spine itself of that whole region, they're going to feel the impacts of plaque and cholesterol and fat within the blood far quicker than we're going to feel it in our heart. So it makes perfect sense that low back pain and chronic spinal pain and discomfort and loss of health is going to be not just an early warning sign of disability or potential disability within the body. This can be an early warning sign of future heart attack or future stroke as these larger vessels only become further blocked over time. So atherosclerosis, which this is a word a lot of people hear but sometimes don't think about. So atherosclerosis, sclerotic, it is literally the hardening and the scarring of these arteries and this cardiovascular tissue. This will impede blood flow to the spine. I mean, think about the discs of the lower back. They're the largest tissues in the body that don't have blood vessels. They're avascular. So that means that nutrition and oxygen and all of these other things, they have to diffuse into the spinal tissue versus being directly delivered with nutrition and blood by vascular tissue. So any small impairment in blood flow is going to impact the spine most likely before almost any other tissue, because it is so in need of easy flow, of easy diffusion of this nutrition. So imagine somebody is eating a diet and living a lifestyle that causes plaques to build up, that causes blood to become thick and viscous, that is causing immobility where there's already going to be further impairment for easy blood flow. Why would it shock any of us then that these choices are profoundly impacting the spine? Just to give you an idea of what atherosclerosis looks like, here, we can see a healthy bit of cardiovascular tissue that's obviously dissected and opened up, but it's beautiful, it's smooth, it's stretchy. If you can, you can kind of see the pliability of it. Look down here. This is atherosclerosis. This is this same beautiful, healthy pink tissue up here, scarred. How well is this going to be able to diffuse blood throughout the body? How well is this going to be able to move fluid and nutrition throughout the body? It's scarred. It's literally hardened and scarred. Nobody even has to know what this is, and they would know this is the healthier tissue. Well, as this is happening in our cardiovascular tissue, everything is impacted by this, including the spine. As cholesterol builds up as these plaques, the lumbar and the middle sacral arteries in particular, they can become damaged, which will not only lead to degeneration within these discs, but this has also been associated in the research with herniation as well. So when we think about bodily health of these tissues, we really always want to come back to, well, how is nutrition being impeded, right? The way that we think of nutrition so often is too limited, because we just think of it, eat some food. Maybe we think of digestion a bit, but we just kind of think of it as the alimentary tube, right? It's just mouth and throat and stomach and intestines, and that's it. Our thought tends to be just in this area. What part of your body isn't nourished? That's what always cracks me up when people talk about, well, you have to nourish yourself at the cellular level. Yeah, that's right. That's the body. That's how nutrition works. Every cell in our body is looking for glucose, is looking for folate, is looking for the exchange of gases. This is happening in my bones just as much as it's happening in my heart. So we have to expand our thought process here about the role of nutrition in health. Because if we're thinking about it just digestively, or maybe some diabetes and heart disease, it is corporal. It is the entire body. So if we think about our arteries in the lumbar and the middle sacral region, as they're damaged, just like the arteries that lead to my heart will cause heart damage, and the arteries that are moving blood throughout the body can cause cerebral issues if my brain's not getting enough oxygen, enough nutrition. Well, that's going to happen within the spine as well. Research is even showing that things like sciatica can be impacted by cholesterol levels, because the same arteries that are impacted by atherosclerosis are those arteries that are going to supply blood to those nerve roots that seem to be associated with this type of pain. So this is the way I would like you to think about this as we're talking forward and going forward with this whole idea of nutrition. If there's impediment or lack of blood flow, that means there's going to be impediment or lack of oxygen and nutrition. And in any tissue where there is inability to exchange nutrition and exchange oxygen, there's inflammation and there is damage. Interestingly, also, this reduced blood flow can impair the removal of lactic acid and other waste products. So we see it kind of on both sides of the coin. It is an issue of inadequate delivery of nourishment, and it is also an issue of inadequate removal of waste. This is not something to which it is ever too early to start. I don't know about you. I can remember when I was a child being told that I better, enjoy it while I can, because when I'm older, I can't eat this way anymore. We have this idea that when we're young, we're kind of invincible, but no. By the age of 20, in large studies that are being done, this is especially being done with autopsy studies where people die in car accidents. So, they can be quite young. 10% of the US population is already developing advanced arterial lesions, the development of this atherosclerosis. There's no age at which it is too early to talk to our patients, our community, our clients, whoever we're working with. our colleagues, about not just heart health, but how what impacts the heart impacts our entire physiology. These plaques, they're slow growing. So it might take 20 or more years for there to be those clinically manifested signs of heart disease. Now I have angina, or now I'm having high blood pressure, or all these things. That didn't just come out of nowhere. This has been building since we were potentially teenagers. So even if you're working in pediatrics, this is a conversation that needs to be had about how these choices that are being made now impact current but also future health as well. So how can we look at our populations that we're working with and understand whether or not some of the physical issues they may be dealing with could be associated with changes in cardiovascular health, or at least those same things that can lead to changes in cardiovascular health? The current recommendation for total cholesterol is 200 milligrams per deciliter of blood or less. That is too high. The evidence clearly shows that these guidelines are too high. A better recommendation is for 150 milligrams per deciliter of blood or less. So if you're working with somebody and you have access to their biometrics and they have a cholesterol of 180, it doesn't matter whether you're working with them for cardiac reasons or not. You have to talk to them and say, we really would love to see this, get below 150. What do you do? What do you eat? How do you exercise? Do we need to refer you to somebody, get you involved in a community health program, something? We got to get that under 150. Non-HDL cholesterol, which is basically your total cholesterol minus your HDL numbers. Current recommendation is less than 130. Again, that's too high. People still get heart attacks. People still have manifestations of disease with levels that high. A better recommendation for people without evidence currently of heart disease is 100 milligrams per DL or less. For people who have already presented with evidence of heart disease, so either they've been diagnosed with heart disease or they're post a heart attack or some other kind of cardiovascular event, we want to get it less than 80. So that total cholesterol minus HDL numbers, we want less than 80 for people who have already been diagnosed with heart disease. LDL cholesterol, low density lipoprotein, the reason why we worry about this one so much, this is the lipoprotein, this is the transport protein that is depositing cholesterol into our arteries and veins. This is the one that's depositing it into our cardiovascular tissue. Current recommendation is 100. Again, way too high. We want to see people get theirs less than 70. And this includes you, by the way. Heart disease is the #1 killer of most Americans, and that includes health professionals. So even for yourselves, thinking about your own health, these are the numbers we want to go off of. I know we're going a little off of spinal health right here, but just to understand, for people with elevated LDL, for every 37 points, so if we can get them from 100 down to 63, they will have a 22% drop in their risk for some sort of cardiovascular event. So it's quite potent. And nutrition and lifestyle modification is amazing in how effective it can be for this. HDL, the reason why we tend to want this higher is not because it's good cholesterol. All cholesterol is just cholesterol. What HDL is, high density lipoprotein, is the transport protein that goes through what's called sometimes reverse cholesterol. It is pulling cholesterol out of our cardiovascular tissue and bringing it to the liver to be recycled or discharged or something, but it's getting it out of our cardiovascular tissue. We want this 60 or higher. Now, quick little caveat here. Sometimes as people are really dropping their cholesterol, their HDL goes down too. That is okay. It's not that HDL doesn't matter, but think about it. If someone is depositing less and less cholesterol into their cardiovascular tissue because they have less LDL, because they're doing all this healthy lifestyle modification, the body doesn't need to produce as much HDL to reverse it out, to get it out, because they're not depositing as much. So current recommendation, 60 or higher, that's good. But really, if I can go back for a moment, total, non-HDL, and LDL. Those are the three that really give us the best insight. Lastly, triglycerides, which are the droplets of fat within our blood. Current recommendation is less than 150. Again, a better recommendation is less than 100. So whether or not you're working with someone for cardiac health, you can look at their numbers and see, and you could say to them, you may not be worried about heart disease right now, but if we can get these numbers lower, that's going to help with blood flow. That helps with inflammation and pain. That might help with your spinal health, your sciatic. All these other ways that we can talk to people to not just look at these numbers here and say heart disease. No, it's heart disease, but it's also spinal health. It's also lumbar health. It's also herniation. It's all of these things that we can talk to people about. The number one nutrient we want to focus on when it comes to reducing cholesterol is saturated fat. Saturated fat is the most, or is the second most stimulating nutrient when it comes to causing the overproduction of cholesterol. The number one is trans fat, and so we'll go through those. But if we can work with people to really get them to be serious about reducing and getting rid of all this excess saturated fat, this is going to help. These are some of the most significant sources of saturated fat in the human diet right now, at least in the United States. Number one source of saturated fat is dairy, specifically in the form of things like cheese and heavy cream and those sorts of things. We have got to get serious about this. Telling people to take the skin off their poultry, that's not doing anything. No, they got to eat less poultry. They got to eat less saturated fat-rich foods, because saturated fat, it's in the muscle. I don't care if someone cuts all the visible fat off, it's in the muscle. We have got to talk to people seriously about, what do you want for your health goals? And if one of them is less inflammation, better blood flow, all these sorts of things, we got to get this saturated fat out. Now, hydrogenated and partially hydrogenated oils, these are the most significant sources of trans fats, which are by far the most toxic types of fats. So significantly reducing these high saturated fat foods, and absolutely eliminating hydrogenated and partially hydrogenated oils are some of the most important things we can do to help reduce our cholesterol. There is no amount of hydrogenated or partially hydrogenated oil within the diet that is considered safe. There's a certain amount of saturated fat, up to about 7% of our calories, that is thought to be okay. It's not going to really impact our cholesterol numbers much. There is not a single drop of hydrogenated or partially hydrogenated oil within our diet that is not associated with increased risk for cardiovascular disease and the associated things we've been talking about with that. So use this with people. Use this with yourself. Your health matters too. But when you're working with people, say, how much lamb do you eat? How much pork products? How much beef? How much poultry? Do you cook with butter? Do you cook with lard? Are you cooking with margarine that's made with hydrogenated oils? Are you putting cheese on everything? Are you putting butter on everything? We've got to talk to people about this, because this is medicine. This is how we can make profound changes and improvements in people's health. We can also do substitutionary benefits. So this is I love this graphic. I use this all the time. This came in from the journal Circulation, where they were looking at comparable foods. So what if I replaced red meat within my diet with an equal amount of calories from beans? So we can kind of come down here to this last one. What this means is everything to the right of this kind of median line here means an increased hazard ratio, an increased risk for heart disease. Everything to the left means we're seeing a decreased risk for heart disease. So if somebody replaced, calorie for calorie, gram for gram, replaced red meat in their diet with beans, we can see just how much their risk for heart disease goes down. If, however, let's say I replace fish with dairy, even low-fat dairy, we see it go up. And what I love about this, it's almost the same for high-fat dairy. So that's why, if I can go back here, dairy products, cream, butter, cheese, milk, these things are causing increased risk for heart disease. We've got to talk to people about, there's lots of plant-based non-dairy versions out there of these things, because you might say, oh, but look, it's low-fat, it's better. If I'm taking something and I'm replacing it, I can actually increase my risk. If I replace poultry with high or low-fat dairy. So that's why when I speak to people, if they can only do one thing, if they will only agree to one thing, it is to replace dairy. It is to start to find non-dairy options. The only food we can see here where bringing dairy in replacement was beneficial was red meat. High and low-fat replacement helped to decrease risk. So what does this type of information tell us? Number one, most important thing a person can do to reduce their risk of heart disease, get rid of red meat. Number two, get rid of dairy. Number three, increase these plant-based options, nuts, beans, these sorts of things. Getting these in to say, I don't need to have a chicken salad all the time. I can, instead of putting chicken on that salad, I can put some black beans on that salad. It's talking to people about food, but helping them to understand that their choices, especially when it's one versus the other, can either increase or decrease their risk for heart disease. It's really amazing. So if we're talking about how this link between heart disease and spinal health and back pain have this powerful connection, this is the advice we want to give to people. Because if this is the advice I would give to somebody to reduce their risk for stroke and heart attack, this means it's also the best advice dietarily to give to someone to reduce their risk of spinal problems, at least from a lifestyle point of view. So we want a diet where about 70% of the calories are coming from complex carbohydrates. These are our whole grains, our fruits, veggies, beans, peas, lentils. 10 to 15% from protein, which means getting rid of excessive amounts of protein. That's a whole other topic in of itself, but excessive protein within the diet also causes atherosclerosis and cholesterol issues. And about 15 to 20% from fat, with heavy, heavy emphasis on getting rid of trans fats, and which are those hydrogenated and partially hydrogenated oils, and really, really, really decreasing those saturated fats. Getting lots of fiber a day. We need lots of fiber. We are a fiber deficient country. Instead of using these hydrogenated fats and using cream and using butter, using things like nuts, seeds, avocados, things like that, and getting in those beans. Not every meal has to have eggs and meat and fish and cheese and things like that. Peas, beans, lentils, really talking to people about how these can be used. Put them in your food. Use the ones you like. They are nourishing, they're rich in fiber, and they're going to be helpful to replacing some of those other foods that can increase those cardiovascular risks that not only put us at risk for heart disease, but again, that can block that flow of blood to the spine, to the nerve roots, all those sorts of things. And get lots of starchy vegetables and whole grains, rice, especially brown rice, corn, oats, barley, white potatoes, sweet potatoes, parsnips, root vegetables, things like that. They're so important. Completely zero trans fat. So hydrogenated and partially hydrogenated oils out. And then processed meats. These are things like bacon. These are things like sausage. These are things like lunch meat and hot dogs and those sorts of things. The World Health Organization has declared these the highest level of carcinogen. So I know we're not talking about cancer right here, but to understand that not only are processed meats shown to be a class 1A or group 1A carcinogen, which means absolutely causes cancer, but these are also tremendous sources of saturated fat, which is again going to have blood flow issue, which is going to impact the spine. And finding more plant-based foods, plant-based options to start to replace some of our heavy overconsumption of animal-based foods. And especially when we're talking about blood flow and healthy blood pressure, watching those sources of sodium, which again, processed meats and those highly processed foods, which are going to have those hydrogenated oils, tend to be our most significant sources of sodium. So as you are thinking about spinal health and sciatica and disc herniation and all of these sorts of things, look at the research here. Again, I swear, I'm not making this stuff up. And you can look these things up for your own understanding. Don't take my word for it, but to really think about physiologically how our body operates. And if you think, well, what is going to cause inflammation? What's going to cause damage, degeneration to the sensitive tissue, especially tissue that is so often avascular? Well, anything that's going to impede blood flow is going to be a problem. And if we know that our diet and our lifestyle choices impede blood flow when it comes to our heart and our brain, it is common sense then to realize that it is going to be a problem for our spine. So keeping this in mind, think about how you can bring this into hopefully at least your personal life, if not your professional life as well, and the ways that you can help people better understand about how their dietary choices are impacting all these other areas of their body.